Dr. Honan to come up, and we've already performed the introduction, and so at this hour, without further ado, we're going to allow Dr. Honan to come to the podium and for his lecture. Thank you. So after the conference, you just take off.
That's great. It's kind of interesting. Christy was talking about STEM. When I was, I think I was a junior at Alabama, I got involved with this really crazy chemistry research group and gave a talk at the American Crystallographic Association, 2 speakers behind the Nobel Prize winner. But now I can go home and tell my kids that I followed the Queen of Baywatch. Any of y'all that are feel entertained by this will be interesting. So I'll try and whip through this a little quick so we don't go too much over. I named this next segment, Bless Your Heart. And bless your heart is a double entendre here, obviously. When we say bless your heart in Alabama, it's bless your heart, And it's kind of where we all live. We all live in a place where we're doing stuff maybe that may not be the best thing for us. And it's like, we really want to learn how to bless our own hearts because nobody else can do that for us. We're the only ones that can do that. Okay, so this is an interesting slide. When I prepared this talk, I actually prepared it for the Alabama Bar Association. They wanted me to give a talk on heart health so that they can learn how to take care of themselves, a high-stress profession. And so I said, you know what, I'm talking to a bunch of lawyers. I better check with my malpractice insurer. And so Chris Egan, who is legal counsel for Starnes, the Starnes Law Firm, prepared this slide for me so that you understand that you shouldn't take anything from this talk away as medical advice. Talk to your own doctor. So anyway, this is actually when I presented this initiative to the state chapter, they also said, well, you think we can handle liability? I said, I already got that slide done because I did it for the Alabama Bar Association. So they were real pleased. So no medical advice today. So why bless your heart? Because you have the power to make a difference. And again, this is going to be presented at each church that we go to as kind of our, the first talk will be our kind of opening talk, but this will be our first informational talk. So why is heart disease important to me? How does the heart work? What is coronary artery disease? Again, the number one cause of coronary or of heart death, number one cause of death in America. Why does it happen? And how do we treat it? And what can I do to prevent it from occurring and from progressing if I have it? Okay, so here's why it's important. Heart disease is the number one cause of death in America. It still leads cancer. If we add in things like stroke and chronic kidney disease and peripheral vascular disease, it's an even bigger cause of death for both men and women in America. Next. So there's your heart sitting inside your rib cage right there in the middle beating. Jason. And so this is the heart. We'll spend a few minutes talking about the heart structure. Let's see, I think I've got a pointer here. So this is the heart. This is the left ventricle over here. This is the main, oops. Can you go back one, Jason? That's the main, or can I go back? Go back one slide. Yeah. Yeah, so the left ventricle is the main pumping chamber of the heart. It's the part that pumps blood out to the body. And these are the coronary arteries on the surface of the heart. We'll talk a little bit more about those in a minute. There's the right ventricle on the front of the heart. This is one of the right atrial chambers. It receives blood from the veins in the body, sends it through the right ventricle out the pulmonary arteries to the lungs, comes back through the pulmonary veins in the back, comes back to the left ventricle where we have oxygenated blood goes out in the body. Let's go to the next slide. And this next slide here is a demonstration of what the heart looks like if it's circumcised. Circular incision around the heart. We're all instructed in Deuteronomy to circumcise our hearts and look inside and see how they work. So this is the actual incision that's made. And this again is the same thing. See my pointer. So we'll just go up here and walk. So this is the right heart again. It receives blood. This is just a big pump. It's pumping out to the lungs so that blood comes back to this side of the heart where it now has oxygen. We can pump it out through the aorta out of the body so we get oxygenated blood to our bodies. That oxygenated blood dumps oxygen in the tissues and picks up carbon dioxide and carries it back to the lungs. So the heart's just a pump to exchange oxygen and carbon dioxide and other chemicals, and so we get blood to the kidneys so they can filter out poisons, blood to the liver so it can make proteins, blood to the brain so we can think, blood to the gut so we can absorb our food. So it's kind of the central conductor of the whole system. This one doesn't show up very well. We already looked at the coronary arteries. These are the arteries that supply blood to the heart, and this is the LAD artery on the front of the heart. The circumflex artery goes around the left side, but these blood vessels allow blood and through the branches to get to the heart. The heart is full of blood, but the blood that nourishes the heart comes from outside, like Jim Bogart showed earlier today. The coronary arteries, the crown artery sitting on top of the heart. So these arteries supply different territories. Again, this is the LAD artery that we said that some people call it the widowmaker. Supplies blood to the front wall of the heart. The right coronary artery over there on the left goes around and supplies blood to the back side of the heart. If you close that artery off, that part of the heart doesn't have adequate blood flow, and we experience, if we're exercising, we have an oxygen deficit to that part of the heart where there's a blockage, and we experience that as chest discomfort or angina, or if it's totally blocked off, we might end up with a heart attack. So this is really, I'm going to spend a couple of minutes on this slide because it's really important. It's really the heart of what we're talking about. This is the process we call atherosclerosis. And this is an artery here. It's like a long tube that blood is flowing through. And if we start over at the left, this is a very young person where that tube has a smooth inner lining that we call the endothelium, the inside lining. And it's very smooth. And as we go through life, we start to develop stuff in the lining of the artery that progressively over a period of decades will narrow this lumen of the artery such that now, as we said, when we're to this stage, we've got a pretty significant amount of blockage. We can't really get enough blood flow through that artery to make the heart happy. And it occurs as a process of inflammation, a deposition of cholesterol into the artery wall to cause narrowing. And if we develop enough cholesterol in here, it actually punches through the surface of the artery and forms like a little sore in the artery. We call it an ulcer. And the body responds to it just like it would if you cut your finger, and it starts forming blood clots on that plaque, is what we call the area of narrowing. And the blood clot can form, and if it gets out of control, it'll clot that artery right off, and all of a sudden we'll have a big growth in the obstruction to that artery, and we call that a heart attack. So these are the symptoms of coronary artery disease. This is what we feel. We mentioned chest discomfort. It may be pain or pressure or just hurting, tightness. Heart attack, we mentioned if it closes off, it would be more severe pain. Heart failure, this is a pump. So if the pump has a lot of damage, that pump just can't pump as much blood flow, and so we get heart failure. We have fluid backing up into the lungs or into the tissues, and we have fatigue because we can't get enough blood flowing forward. And we can also have heart rhythm problems, atrial fibrillation, a rapid irregular heart rhythm. We have ventricular fibrillation, which is usually sudden death, where somebody with having a heart attack would just drop over dead, like Dr. Bogart's did, although he wasn't having a heart attack with his. It is the most common form of heart disease, and it kills 370,000 people a year. As we mentioned, about a quarter of the people who die every year die from this. So these are the signs. We mentioned the chest pain, which can be pain or pressure, tightness. Shortness of breath. Some people won't have any pain. They'll just get short of breath when they walk across the room or walk up the hill or while they're out running. That may be their first sign of having heart blockage problems. We mentioned fatigue, if it's enough to impact the pump in a negative way. The nausea and vomiting actually occurs. People that are having a heart attack will usually have severe crushing chest discomfort, often in the middle of the chest. It may go to an arm or the jaw or to the back. They will have a more likely chance of having nausea, vomiting, sweating, shortness of breath. And they may have all or some of these signs. Next. So again, as we mentioned before, so this again is the LAD artery on the front of the heart over here, going down the front of the heart. We see there's a blood clot in there. This part of the heart is now
taught me
it's getting irreversible damage, and we call that a myocardial infarction or a heart attack. So that's what a heart attack is that clot that's closed that artery off and caused heart damage. So again, these slides that I have, a lot of these that say at the bottom, cardiosmart.org. This is a website you can all go to. If you have a heart problem, this is a really good website. It is a website that's maintained by the American College of Cardiology for patient information or for talks to people having situations. So the slides of that heart pumping is on there. These slides are on there to help you to be able to understand what we're talking about. Can you go back? So again, the important things on here are early care saves lives. So that heart attack that we showed you in the last slide, if you just leave that alone, 24 hours, that part of the heart will be basically dead and may not ever recover any function in that part if you don't die when that happens. But if you get to it early, you can prevent all or almost all of the damage that would have happened to that heart, because we can go in there. Most hospitals in Alabama will get you, if you present to the emergency room, within an hour of you presenting, we'll have your artery open. We'll get your EKG, they'll call us in, we'll get the cath lab in. We're really focused on opening those arteries up to prevent you from having irreversible heart damage and dying. So again, we mentioned chest pressure, tightness, squeezing or burning, chest, shoulders, arms, back, neck, or jaw, shortness of breath. You may just misinterpret, you thought it was indigestion. We see that a lot. Women also have chest pain, but they may also have some of these other symptoms like shortness of breath, lightheadedness, and then we mentioned the nausea, vomiting, sweating, lightheadedness, and feeling anxiety. So again, if you think you're having a heart attack, if you're still having chest pain after 10 or 15 minutes, call 911. Get to the hospital right away. If you were going to have that ventricular fibrillation, sudden death, and you're in the ambulance on the way, they just shocked you and you're back alive. If you're in a car, you and maybe somebody else is now no longer with us. So these are what we call risk factors for cardiovascular disease. These are the things that you have that put you at higher risk. On the left side of this slide, we have what we call unmodifiable risk factors for heart disease, things that you can't change. Age, male gender, I guess we can't change that. Our genetic male gender. Family history of early coronary disease, before age 55 in a man, 65 in a woman. Chronic kidney disease, we can impact that some. Genetic factors, and even just being an African American is a risk factor as it currently exists in places in Alabama and is not a risk factor in other places. Like if you're in America and you're over age 65, being an African American surprisingly is not a risk factor any longer because you've overcome a lot of the struggles that a lot of others go through early in life. So by the CDC website, that is no longer a risk factor. Then there are the modifiable ones. We'll spend a few minutes talking about the big four at the top. Cigarette smoking being the one that you can most impact and reverse and get rid of. And secondhand smoking, surprisingly increasing your risk of a heart attack 30 or 40%. High blood pressure, cholesterol, low HDL, high LDL, diabetes and insulin resistance. So those are the big four: smoking, high blood pressure, cholesterol, and diabetes. Being overweight or obese increases three of those four. So it's very important. Poor diet, physical inactivity, and low fitness, what Christy focused on with her presentation today. Psychosocial stress and lack of sleep, cocaine, amphetamines, other stimulants, decongestants, something called HSCRP, which we won't probably spend much time on that today. And then low socioeconomic status and obstructive sleep apnea that we heard about earlier with Dr. Padoff. Also important in terms of increasing insulin resistance, increasing high blood pressure, cholesterol, diabetes. So these are just kind of giving us an idea of how much of your risk can we define through what your risk factors are. If you're a smoker and you have a heart attack, 36% of your risk is wrapped up in the fact that you're a smoker. You probably also have more than just one risk factor. You probably have a combination if you're young, being a smoker and a diabetic and having high blood pressure. So each of these risk factors contribute to your risk of having a heart attack. And if we put all 9 of these risk factors together, we can identify 90% of your risk of having a heart attack. You know, some other ones were genetic disorders, other things we might not be able to identify. So this is a slide that really drives home the importance of controlling every bit of risk that you can. We mentioned that being a smoker it roughly says 2.9 up there, roughly triples your chance every year of having a heart attack, congestive heart failure, dropping dead, dying in general by being a smoker. If you pull that up with diabetes, you take that 3 and you multiply it by the 2.4, and now you've got an 8-fold risk of dying each year. You throw in high blood pressure, which, you know, some things will say 2 to 3 times for each of these, increasing your risk. You now have 1 plus 2 plus 3, you got a 13-fold chance of having a heart attack because you've got all 3 of those. The more risk factors, the more trouble. And if you throw in 5 or 6 of those, you're going to get in trouble. You're not going to be able to escape trouble. At the same time, the power in somebody that has multiple risk factors and getting rid of one of them is enormous. You know, you can cut a 182-fold risk to a 68-fold risk by getting rid of one of those. So that's enormous benefit in addressing every one of these risk factors. So we'll talk for a few minutes about tobacco. This is some data on the risk on the deaths in America caused by smoking. And these numbers are a little bit old, but the Surgeon General didn't put out a report for a number of years after this. But we can see that of the heart disease deaths, we've got about 25% of those are wrapped up in smoking, an even higher proportion of cancer deaths and COPD deaths, such that the total deaths by being a smoker is estimated to be 480 to 580,000 people per year in America. Huge. And if we look at the next slide and we do the math and we added up all those orange bars, we see that the deaths caused by smoking exceed, if we take out the deaths from heart disease caused by smoking, they even exceed the deaths from heart disease overall. So this is a real important thing to focus on. So again, this same number was quoted in the 2020 Surgeon General's report, 480,000. Every year since 1964 that they published this report, number 1 preventable cause of morbidity and mortality in the U.S. 19% of all deaths in America caused by smoking, an even higher portion in Alabama. More deaths than all these other common causes combined. We worry about war. Since 1964, it's caused greater than 10 times as many deaths as in all the wars. It reduces the lifespan of the average smoker if you're a male by 13 years and if you're a female by 14 years. Just huge. And these are all the other things. I've roughly broken these up into thirds. A third of the deaths from heart disease, a cardiovascular disease, a third from cancer, and a third from a whole host of other causes. We mentioned that bunch of coronary heart disease and heart failure and stroke, and cardiomyopathy is just a weak heart muscle, aneurysms of the aorta, peripheral artery disease. So those are all the cardiovascular issues. But the cancer issues are also huge for almost every kind of cancer there is. It impairs our ability to heal problems with our DNA. I think we all know that people that have COPD, chronic bronchitis, emphysema, almost all of them, especially our respiratory care folks in the back, almost all of those are caused by smoking. It increases your chance of getting stomach ulcers, Alzheimer's disease, problems with your pregnancies, makes your rheumatoid arthritis and your pain worse, your osteoporosis. It just goes on and on and on. So it's the gift that keeps on giving. But the good news is, you say, well, I've already been doing this for 30 years. Well, if you stop, you can make a big difference. And this looks like, at the bottom here, at the age that you quit smoking, how many years of life you get back versus if you continue to smoke. So, if you're 40 years old and you quit smoking, you still get 9 years of life back by quitting at age 40. So it's never too late to address and it's worth putting some effort into. So these are I just wanted to focus on a few positive messages. We don't get a lot of traction out of giving all this information out to patients. I try not to give that to them because most of them know it's not a good thing to do. Most of them want to quit, they just don't know how to get there. But the important thing is you can do it. Most people in America that smoked at one point in life have quit. There are more people that have quit in America than people that still smoke. Don't give up. Be positive. Don't look at, I'm depriving myself of this thing that has been my best friend all these years. Look at, I really want to be able to walk better. I want to see my kids grow up, my grandkids. Set goals. And, if your goal is to cut back from a pack a day to a half pack, and you're still at 3/4 at the end of 2 weeks, hey, that's a huge plus. Be positive about your gains. It takes a lot of determination, a lot of perseverance. If you slip up, don't beat yourself up for it because that's going to make you want to smoke more. Just, just pick up and move on. Substitution is helpful. We like cinnamon flavored toothpicks because it still gives you that hot in the back of your throat. Celery sticks, not Snickers bars because you're doing 70,000 times a year you're doing this. So you got to find a substitute that doesn't make your situation worse. I think a lot of people look at smoking as an alternative means of dealing with stress. It actually potentiates nicotine withdrawal, which feels like stress. So that if you want to reduce your stress, you want to get rid of nicotine withdrawal. So this is a good message to deal with. So a lot of smoking occurs when we're bored, so stay busy. Doing exercise will help give you a lot of the same chemicals that smoking a cigarette. When you smoke a cigarette, that nicotine goes to the brain, it hits the nicotine receptors, they release the chemical called whatever it is, the positive feel-good chemical, dopamine in the brain. And you can get that same chemical and some other chemicals by exercising. There are medications that can help. There's a website that's real good. So we'll wrap that up there. The next topic is cholesterol, and I'm going to make this really brief because Dr. Mirza, who's following me, will be talking about that. The main thing on this slide is this part right here. So this is the lumen of a vessel. This is what we the artery cut in half. This is the line of the artery, and this is the wall of the artery. High LDL cholesterol drives cholesterol into the artery. And the next slide. Having a low, go back one. Having a high HDL cholesterol will drive plaque, will drive cholesterol out of the artery so that you can get rid of it through your liver and other mechanisms. It's a very complex process, but controlling your cholesterol is hugely important in reducing your risk of having blockages. Next. And so the things that you can do to help your cholesterol: live a healthy lifestyle, talk about your risk and chances of having a heart attack so you will have some motivation, take your medications if prescribed, and follow up on it. Jason. Okay, so this is a really important slide. This is what Christy was talking about, healthy eating. This is healthy eating. I think it's what we all kind of know. When we went over to Subway for lunch, it's like we try to maybe not do they don't have fried chicken over there or pork chops. We try to focus on doing a lot of the veggies. Veggies are good, some fruit, and you don't want to eat lots of fruit. I have people, Doc, I've been eating bananas and grapes all day. Well, there's a lot of sugar in there, so you have some. It's better than Snickers bars. But we want to do some fruit because it's healthy. Vegetables are healthy. Whole grains, when we use bread, nuts and other beans and stuff that are high in protein as a protein source, and then fish. Olive oil as supplements, and maybe a little bit of wine. I don't really promote wine because it has some negatives. It helps your HDL, but it may kind of help hurt your driving record. So being a vegetarian is also helpful, and there's a diet called the DASH diet that I think Dr. Haig may tell us a little bit about a little later on. Cut back on your processed meats and saturated fats, avoid trans fats, and drink water instead of sodas and juices. Juices have a lot of sugar in them. Blood pressure, and these slides are courtesy of Dr. Miller, who gave me an earlier form of this talk a few years ago. Next. We'll kind of whip through this. Out of office blood pressure measurements are much more helpful than the ones you get in the doctor's office. So we will teach you how to do that. Next. This just kind of tells us about blood pressure. What is a healthy blood pressure? The American Society of Hypertension, American Heart, American College of Cardiology have redefined normal blood pressure as being 120 over 80 or less, mildly elevated as being 120 to 130 over 80, and if you're more than 130 over 80, being high. If you've got risk factors for heart disease, stroke, or peripheral disease, you want your pressure less than 130 over 80. If you have no other risk factors, 140 over 90 is acceptable. You want to use the right size blood pressure cuff. When you purchase your cuff to use at home, you can get a good cuff for $40 to $80 at Walmart or at CVS. Next. And this is just to say that even at age 65, we used to think it was okay if you're older to have higher blood pressure. We no longer believe that to be the case. James. Weight loss is good. Diet is good. DASH or Mediterranean are good. Sodium reduction. Potassium supplementation, as long as you're not on medications like some of what we call the ACE inhibitor drugs like lisinopril or some of the ARB drugs like losartan, that may also make you retain potassium. So make sure you're not on any drugs like those. These will also help reduce your blood pressure. Increasing physical activity will help. Move on to the next one, James. Drinking a small amount may not be detrimental, but drinking more than a couple of drinks if you're a man, or one drink if you're a woman may be detrimental to both your blood pressure and your general health. Next. Diabetes. Next. So this is basically, I won't spend much time on this. Being a diabetic is a huge risk factor for early vascular disease, as I'm sure many of you know who have family members with diabetes, especially if you couple it with high blood pressure or cholesterol. It's as big a risk factor for having a heart attack as if you'd already had one. And if you combine that with a history of a heart attack, it's really a huge risk factor for having another heart attack. Next. And this basically shows you your level of diabetic control. The hemoglobin A1C being less than 5.7 is normal, 5.7 to 6.4 is what we call pre-diabetes, and being more than that is frankly diabetic. We see people with hemoglobin A1Cs of 11, 12, 13%. That's a huge increased risk for having cardiovascular disease. So any level of control you can improve will be very helpful in terms of preventing death and preventing heart attacks and cardiac events. Being a diabetic also causes retinopathy, which is eye problems, blindness, spilling protein, microalbuminuria, spilling protein in your urine, and as we know, heart attacks. Okay, next. So these are other factors. Obesity, I think I mentioned, plays into having higher blood pressure, having higher cholesterol and triglycerides, being more likely diabetic, and having a whole host of other issues like sleep apnea. So this basically shows the effect of CRP of being obese, having a raising your CRP level. CRP is an inflammatory component that also contributes, it's an independent risk factor for atherosclerosis. Next. And so it also, being obese is associated with a whole bunch of other things that cause inflammation in the heart artery walls and also can lead to coronary artery disease and heart attacks. Next. And we'll go on. This slide is basically showing the benefit in terms of all these risk factors if you lose weight. And in this study, they did stomach bypass surgery. Or no, this is the dietary study showing that losing weight favorably impacted all these inflammatory markers. So exercise independently is also good in terms of reducing weight, diabetes, high blood pressure, cholesterol, triglycerides, but it also independently has beneficial effect on improving blood flow to the heart through improving what we call coronary collaterals, even in people next that have blockage in their arteries. This is just showing, this is an arteriogram. This is an LAD artery here that somebody's done an arteriogram on. And that artery you can see had a really tight blockage up here at the top. This person at baseline, when they exercise, these are some nuclear pictures, and this is looking at blood flow that did not increase to this front wall of the heart, whereas it did increase in the area of the circumflex artery. It's so tight, the blockage there, that when you exercise, it couldn't augment blood flow to this part of the heart. But after this person exercised and worked on diet and did yoga for a year, they had an almost normal nuclear stress test, even though the blockage was still pretty tight. Next. So, active and mindful living is also very helpful. Physical activity really helps support a stronger heart, improves blood flow, helps self-esteem, promotes sleep, lowers blood cholesterol, blood sugar, and decreases the need for medications. Next. Moderate exercise. Exercise is good, more is better. If you walk 30 minutes, it's twice as good as walking 15. The American Heart Association now recommends 30 minutes, 5 days a week, 150 minutes of aerobic exercise as being a starting place. So you can do it a lot of different ways. You can do it walking, swimming, cycling. Stress reduction, also very helpful in reducing cardiovascular events. Yoga, breathing exercises, music. Next. And again, how to prevent it. Modify your risk factors. Don't smoke, exercise, eat healthy, manage your stress, know your numbers on your blood pressure and your blood sugars and your cholesterol, and get to a healthy body mass index and ideal body weight. And how do we treat it? Lifestyle changes, medications, cholesterol, keep your diabetes controlled. And then we do procedures, cardiac catheterizations and stress tests and stents and bypass surgery to help in other situations. So in summary, these are the management strategies you want for cardiovascular risk reduction. If you smoke, cut back or stop. Cholesterol, typically we'll use statins first line. And Mediterranean diet is going to help all these things. High blood pressure, we're shooting for a blood pressure less than 130/80 with medications, even lower if we can with lifestyle. The obesity, there's a great benefit to getting your BMI less than 30, maybe a little more benefit to getting it less than 25, but if you can get it less than 30, that's hugely helpful. You're shooting for a good hemoglobin A1C. If you've got a lot of risk factors and you have known coronary artery disease, aspirin is still recommended, 81 milligrams a day. If you have none of those things, probably there's not any benefit to taking an aspirin, so that's what you've been reading in the press. And then manage your stress and get some sleep. Treat your sleep apnea, and there's a lot of stuff, a lot of vitamins sold for potential benefit. That has never really, at the last that I looked, has not really been shown to be of benefit, taking a lot of vitamins. So you will hear a lot of the same things in these upcoming talks, and that's part of the design of the program that we're doing. It's hard to pick up on all this stuff on one visit, But as we hear this over and over again, hopefully it'll draw.